plasma is the fluid portion of the blood. Presumably, all these substances live in the plasma. As you said earlier, the plasma is the milieu, it's the environment of the cells, the stem cells and other cells that function within this environment. So the environment is very important. The ancient Greeks and the Romans believed that substances in the blood are responsible for forming the character and the demeanor of people.
Is it really different, apheresis, from dialysis? And also, what is the actual mechanism of action? Do we even know a mechanism of action behind this apheresis? Is it like, getting rid of the old signaling factors in the blood that basically helps us with rejuvenation? Are you doing like an, so to speak, oil change?
Cures, Remedies, and Beyond podcast with Dr. Irina, a Stanford-trained medical doctor, inventor, and a published author with over 30 years of clinical experience, is bringing together the science of medicine and the art of healing for ultimate vitality and health. It engages in discussions with healthcare providers, wellness experts, innovators, philosophers, spiritual and industry leaders, as well as health and wisdom seekers to provide you, the listeners, with practical tips and knowledge to help optimize your health and well-being. The Cures, Remedies, and Beyond podcast with Dr. Irina.
Welcome to the show. Today, we will discuss aging and a specific tool that has shown promising results in slowing it down in humans, not in mice. I'm talking about Therapeutic Plasma Exchange, apheresis, or so-called plasmapheresis, a very intriguing and super popular topic these days among anti-aging specialists and many health enthusiasts as well. To discuss this, we have invited an internationally recognized pioneer in the field of therapeutic apheresis, the founder and president of Global Apheresis Society, Dr. Dobri Kiprov. Thank you for joining us, Dr. Kiprov.
You're very welcome. It is a pleasure to be here.
You have more than 100 publications in the field of immunology, immunotherapy, and apheresis. And after your most recent research and publication last year on therapeutic plasmapheresis and clinical practice, you have become a leader in the prevention and treatment of age-related medical conditions. You were first to publish on the effect of the Therapeutic Plasma Exchange, you call it TPE, on aging, long COVID, and placebo-controlled trial in Alzheimer's disease. In addition to your clinical practice, you're passionate about educating others and sharing all your knowledge. As well as you are recently a co-founder of a new organization, I understand, Life Extension Advocacy Foundation. That's very impressive. We don't know exactly the causes of aging, but there have been many attempts to reverse age-imposing disorders and to slow down aging, improving not only our lifespan, but more importantly, our health span. In the late 1990s and early 2000s, experiments were done in vitro with cells and cultures, meaning in petri dishes, of course, including at Stanford lab, where young cells were placed in old blood or serum, leading to almost immediate aging of those cells, behaving like old cells in the matter of hours. And vice versa, when old stem cells were placed in young blood serum, they exhibited rejuvenative responses and behavior. This led to earlier guesses that aging might be systemic and that some factors in our blood or our serum might have age signaling mechanisms. So I wanted to ask you, Dr. Kiprov, what is the exact history and more, I guess, historic background on the unique mechanism of apheresis, and what is apheresis that was pretty much established, I guess, as a therapeutic treatment many years ago, and you were, of course, the first pioneer in this field.
Yes, the word apheresis comes from the Greek and it means to take away. The history of people guessing that there are substances in the blood that cause all kinds of problems is not new. It's actually millennia old. The ancient Greeks
Really?
and the Romans believed that substances in the blood are responsible for forming the character and the demeanor of people. In addition to that, they thought that substances in the blood, which they called bad humors, cause diseases. And in order to treat that or prevent it, they invented bloodletting. Bloodletting was not a very pleasant procedure, and it's questionable whether it saved anybody's life. It certainly killed our first president. So this doesn't deter them from practicing bloodletting until late in the 19th century. So the idea is not new. Today, apheresis refers to a medical procedure which is automated, computerized, very sophisticated, and much more benign than the bloodletting. We have a little video here that will show you the procedure and the experience of the patients. So the patient is in a bed or in a reclining chair, is attached to a machine, and there are two venipunctures, so there are two IVs in one arm, one and the other arm, and the blood is withdrawn, the whole blood is withdrawn into the machine and separated into red cells, white cells, and plasma. The plasma is the fluid portion of the blood. Presumably all these substances live in the plasma. As you said earlier, the plasma is the milieu, it's the environment of the cells, the stem cells and other cells that function within this environment. So the environment is very important. And just imagine a aquarium with fish. When the water is clean and the fish has food, it provides an environment where the fish swim freely and live healthy life. However, if the water is not clean and there is no food, they die, obviously. So the same happened to the cells that you described. Now, in terms of aging, the turnaround of our thinking of employing plasmapheresis into this field comes from animal model called parabiosis. And Irina and Michael Comboy, currently from the University of Berkeley, UC Berkeley, did the seminal experiment in 2005. At that time, they were in Stanford. And parabiosis is basically connecting the blood circulation of two mice and two genetically identical mice. And when you connect the two circulations, then there are two things that happen. One is you dilute the blood of both animals. The other is that you infuse substances that don't exist in one of the animal into the other. And they found out that the young mouse became old with exposure to the old blood, and the old mouse became young with exposure to the young blood. And the immediate assumption was that there's something in the young blood that creates this thing. And as you know, the fountain of youth has been looked for thousands of years. So they decided that that's going to be the case. They didn't decide that, but most people decided this, and they started looking into infusing young plasma taken from younger individuals, into older people. I started working with the convoys shortly after their discovery, and they asked me to see if I can create parabiosis in humans. It's not an easy task, but I suggested to do plasma exchange. And the question was, yes, we can use the machine to throw the plasma away, the old plasma away. The question was, what do we replace it with? Because we remove large quantities, 2-3 liters, and we replaced the natural thing was to replace it with young plasma. And I was very much opposed to that, because practicing apheresis really for many, many difficult diseases, primarily in ICU setting in the hospital. And I know very well that exposure to fresh frozen plasma, regardless of the fact that it's taken from healthy individuals, can cause from mild to serious side effects. So I was opposed to that from very beginning, and we decided to use a pharmaceutical component called 5% albumin. And since then, we've done many experiments, both in mice and in humans. And as you mentioned, our latest research was a placebo-controlled clinical trial, definitely showing very encouraging results.
Yeah, that is such a unique treatment. Of course, I tried it in your clinic, so which was really easy, so to speak, experience. So, and I just want you to explain a little bit more to our listeners. Is it really different, apheresis, from dialysis? And also, what is the actual mechanism of action? Do we even know a mechanism of action behind this apheresis? Is it like, getting rid of the old signaling factors in the blood that basically helps us with rejuvenation? Are you doing like an, so to speak, oil change? So that really helps people to feel better, and of course have more anti-aging effect.
The analogy with oil change is relevant. My combo uses that analogy all the time. So there are a couple of problems that are scientific that have arisen since we started this whole experiments. And that is that there is obviously something that happens, whether we dilute the bad stuff or we infuse good stuff. It's still questionable, although we believe that dilution seems to work very well with in a controlled clinical environment. So most of the mechanism of action is removing whatever we're removing. And the problem is that we haven't been able in the last 20 years to identify exactly what are the so-called generic factors. Generic means causing aging. So we haven't been able to do that. And other scientists, we haven't been involved in that, but our scientists have been looking to see if there are any youthful factors that can be infused. This has failed too. Nobody knows exactly what is going on either side. Our experiments in humans show that removing whatever we are removing in large quantities, because we're removing all the plasma, not specific certain substances, works well. One thing we know for sure is that inflammation is a major contributor to aging and a variety of chronic inflammatory diseases. Actually, the most common diseases in older age, Alzheimer's disease, type 2 diabetes, cardiovascular disease, which is stroke and
Heart attacks.
and so forth are chronic inflammatory diseases. And remember, people don't die of old age. Very few people die of old age. People die of diseases. And
Right.
these diseases that I just mentioned really occur much more frequently in older age, after 60, 70 years old. And so older people are predisposed to develop these diseases and die of them. And I think that the COVID-19 pandemic proved that.
Right.
The majority of the people who died in the pandemic were older individuals. So we know that inflammation causes aging, and removing anti-inflammatory factors, which we know, they're well established. Now, there may be others as well, but removing inflammatory factors and creating an anti-inflammatory environment seems to be one of the causes for our success using apheresis in aging.
And you also have been using it successfully, I understand, with long COVID. Is that correct?
That's correct. We were the first ones in the United States to publish the use of apheresis, therapeutic plasma exchange, actually in long COVID, and we recently published our experience over the last 2 years. So yes, there is. We have success rate about 65% in long COVID.
Oh, that's impressive. What other disorders would this particular treatment good for? I mean, ameliorate or curative results, with apheresis?
Originally, the first use of therapeutic plasma exchange in humans was done in a disease called Waldenstrom's. So it's Waldenstrom was a Swedish scientist who described this disease, and basically it's characterized by the production of IgM. That's a immunoglobulin that accumulates in the blood that makes the blood look like jello. So it's thickening of the blood, and it can cause all kinds of problems. You can imagine if your blood is thickened, it will obstruct blood vessels and cause all kinds of problems around the body and the brain. So
Thrombosis.
and so exactly. So they used for the first time plasmapheresis to exchange this plasma with normal either plasma or the albumin. But later on, it was used, and even today, it is used primarily to treat autoimmune diseases. And autoimmune diseases are characterized by circulating autoantibodies, antibodies or proteins that attack your own body. Or also there is something called immune complexes, which are antibodies with other antigens combination. They can accumulate in the kidneys, in the brain, in the heart, in the skin, any place in the body, and cause problems. And because they are larger substances, they are in the blood, they are easily removed by therapeutic plasma exchange.
Yeah, and myasthenia gravis, I understand, one of them that you've been helping.
Yes, myasthenia gravis
people.
is one of them, and it is characterized by an autoantibody that attacks the junction between the nerve and the muscle. And it does not allow the interaction between the nerve and the muscles become weak, and the patients are very, very weak.
Yeah. Well, one of my, again, going back to anti-aging, so to speak, I wanted to ask you about your results with the apheresis. You mentioned the groundbreaking studies that were done, I believe, in 2005, as you mentioned, by the bioengineering Convoy Lab, Irina and Mike. So, and during their experiment, of course, when they did the parabiosis and exchange young mice blood to the old mice blood. So they actually noticed that there was a significant rejuvenation of the muscle tissue, liver tissue, and some signs of the neurogenesis, or so to speak, rejuvenation of some parts of the brain. Do you see something like that in your patients that are primarily, doing the apheresis for the anti-aging purposes?
So there is difference between what the comboys did and what is possible in humans. So they made these observations morphologically, which means there was an autopsy of they killed the mice and examined their muscles, their brain, their tissues, their liver, and so forth. So obviously, we cannot do that. I have stressed many times that we are not mice. So you have to be careful. However, we used other parameters to measure some of these things. So one of the parameters that we used was muscle strength, and it's used with squeezing a certain instrument that gives you different pounds and so forth. We used speed of walking. We used balance, standing on one foot. And today, everything is related to AI. So we used an AI program which measures overall health and overall psychological health. And in all these parameters, the patients that were in real treatment group did very well. In addition to that, we measured the biologic age of all the patients. For those of you who don't know what biologic age is your chronological age is your real age. So you're born in 2000, today you're 24 years old. And your biologic age may be older than that, or maybe younger than that, depending on how your body ages, your tissues, your blood, your organism. And primarily by measuring DNA methylation, and there are some other tests as well, one can measure biologic age today with sophisticated tests. And we measure that, and that's a very popular test today to do. And we measure just about every test within this realm that is available today by the best labs. We work very closely with the Buck Institute for Aging and with other specialists in the field, including the pioneer of the DNA methylation of the biologic clocks, Steve Horvath. He did some of our experiments as well. And in most of these parameters, we showed that the biologic age was decreased in the treatment group and actually increased in the non-treatment group, the placebo group, as you would expect. They got older. So doing all these experiments, we tried to mimic what the comboys observed in mice, and so far it looks like we did. In addition, as you mentioned, we have done a controlled clinical trial in Alzheimer's disease, which is the most common age-related disease. And we did that before this particular experiment, and we also controlled placebo-controlled clinical trial, and we showed considerable difference between progression of the disease in the treatment group and the non-treatment group, as well as improvement of some parameters such as cognition and language in the treatment group of the mildly affected patients. As in any disease, including Alzheimer's disease and aging, the sooner you intervene, the better chances for success.
Yeah, that's very impressive. And you mentioned the biological age. You saw the shift in your therapeutic group, right? So in your clinical group. So what would be an average, I guess, number of years that you see that would actually reverse?
It varies. It varies. It's individual how the people respond to the treatment, and it varies by the tests that we do. So not all parameters are back in from the analysis. So I don't know exactly the answer to your question, but it varies.
Mm-hmm. Well, that's very interesting. So we're going to take a very short break, and we'll be right back.
This podcast represents the personal views and opinions of the host and the guests and does not constitute medical advice. The statements contained in this podcast have not been evaluated by the FDA. Any products or treatments mentioned are not intended to diagnose, treat, or prevent any disease. And now your host, Dr. Irina.
And I have another question about the success, I guess, of apheresis treatment. You had such a remarkable, of course, recent study that you published last year and presented at the A4M, the World Forum on Anti-Aging Medicine, that you saw not only biomarkers and so to speak, different protein markers, measures of change, but you also saw the clinical and physiological parameters changed and shifted that are significant for aging, as you said, the strength, muscle strength, the balance. So it's really impressive, I have to say. But my question is, how many treatments would you usually suggest people to do to achieve, just for, regular anti-aging, not disease-modifying treatment? And how long would those changes last?
Very good question. Based on our preliminary studies, where we did few patients in the beginning, we didn't know how it's going to work, and we determined that 6 treatments seemed to be optimal, and we did a controlled clinical trial using 6 treatments at different intervals. So one group used them once a month for 6 months. Another group used 2 treatments per month for 3 months. There wasn't much of a difference in the overall outcomes. So 6 treatments over a certain period of time seem to work pretty well. At the present time, we are studying the follow-up of all these participants in the study to see how long it lasts. And again, it is very different. People respond differently to the treatment, but also the effect lasts at a different interval. So we don't know exactly the number, but it's going to be different for different people, and we would recommend different schedules for continuing the treatment, because aging is a chronic disease. It never stops. So the treatment of aging should never stop either.
That's interesting. Like, you never stop oil changing in your old car, right? So you
right.
have to maintain it.
Right.
So yeah, that's fair enough, I guess. And tell me, are there any side effects people have to be aware, like, before they pursue, let's say, anti-aging protocols, because obviously they're not desperate, they're not having life-threatening disease, so
Right.
they just want to really, live healthy life and have a good health span, so to speak, right? So
that's right. This is why originally I was against the use of fresh frozen plasma, because it is associated with significant side effects. What with the 5% albumin which we use, so you have to say this up front, that if the procedure is performed by experienced personnel, people who know what they're doing, the side effects are minimal. In our Alzheimer study, the side effects were less than 10%. In our anti-aging study, the side effects are less than 1%. And they're very mild. So I think that the worst part of the treatment is sticking 2 needles, one in each arm, and it's obviously unpleasant. But in experienced hands, this is also okay. You've gone through the procedure with my nurses, and you know it's not a big deal. But sometimes there is some tingling around the fingers, maybe drop of blood pressure, but very, very rare. And allergic reactions to the albumin are extremely rare. 1,000 procedures we've seen too.
Oh, that's. I mean, I was a recipient of a few of your treatments, of course, and yeah, it was pretty easy. And I have to say also, I had quite a lot of compliments a few weeks later. So some of my friends would actually ask me, what happened to you? You look younger. So I don't know if it was just, because they didn't see me for too long.
Happy to hear that.
Yes. So, which of course wasn't the main reason that I came to you, as you know, but it was a wonderful, beneficial side effect for me personally. But so I'm curious, of course, everybody these days aware of the telomere length, as a measure of the, one of the measures of the biological clock. So do you guys measure the telomeres as well or not really?
It was not in the protocol. However, we have stored blood, and actually, in some of the patients, the telomere length was measured, and it is relevant. However, it is not an easy test to do, and it is not very much reliable. It varies depending on the time of the day and how the blood is processed and all that. So there are too many variables, and we decided not to start with that because, we don't know exactly how to.
It's not as accurate, of course, as you would like
Yeah,
it to be.
so, yeah.
Mm-hmm. As opposed to DNA methylation. I
Right.
see. Yeah. Okay. Well, that's interesting. I mean, what are the other biomarkers do you guys measure? If you could just give us a few names of, I'm just curious.
Oh, we measure before the controlled clinical trial. In our preliminary trials, we measured the same biomarkers. So there are proteomics, different proteins in the blood. And we measured about 6,000 different ones.
Oh, wow.
There are metabolomics, which is different.
And what, excuse me, what is the metabolomics for our listeners?
Different lipids, hormones and stuff. So participants in the metabolism that play a role. For example, we measure different lipids. There is something called apolipoproteins. And for example, if there's about, I think, 25% of the population have them elevated. It's a genetic thing. And these people have, I believe, 70% greater chance to develop heart conditions. So that's one example. And so important substances in the blood that can cause diseases. And again, we really don't know what are exactly the genetic substances, and we hope that some of our answers, once all the analysis will back, will give us some idea. But right now we don't know. But one thing that we did discover, which I think is very important, is related to senolytic cells. So there are cells in the body that are called senolytic cells, which means aging cells, and they are being blamed for aging, for the aging process. So these cells, as they age, and even before that, they produce all kinds of pro-inflammatory cytokines and chemokines. It's called SASP, SASP. So senolytic related phenotype. And interestingly enough, we measured the different SASP proteins, and we identified we removed them basically with the plasma exchange, which is a very important phenomenon because senolytic cells have been blamed for aging, and there are attempts to kill them with the senescent cells. I'm sorry, they're called senescent cells, and the senolytic substances are the ones that kill them. However, they're not benign. They can have all kinds of problems. So there isn't a well-established senolytic approach. But the fact that we remove their products that cause inflammation and disease is very significant.
Oh, that's quite remarkable.
Yeah.
I also wanted to ask you about your Lifespan Extension Advocacy Foundation. If you could tell us more about that.
Well, I don't know if the term is correct. So I'm a co-founder of a company called Lifespan, and it's spelled LYFSPN.
Okay.
So it is a company that we formed, and a company that actually sponsored this study, so that we can do it without having to charge the patients. And we hope that the company will raise enough money for us to do other experiments and expand what we do, not only to Mill Valley here in California, but other places around California, around the country, and around the world. So that's the hope. It's at the very beginning of a journey, but we already have affiliate clinics in Florida and Southern California and Australia.
Wish you good luck with that. Quite amazing, path. But could you tell us what are you currently working on? So, or you're aspiring, anything specific that you're curious about and you want to study more, research more. So what's in your plans?
Always we're working on new stuff. I'm not at liberty to discuss that on national TV.
Okay, fair enough.
New things are coming. I don't know how fast, it depends, but we're always looking to either add something to the plasmapheresis or replace it if necessary. We're working on new technologies for apheresis as well that are more specific, easier to tolerate, faster, this kind of thing. So there is a lot to be worked upon, and we're doing it. So I'm not resting right now.
Yeah, knowing you, I know that. So that's wonderful. That's really wonderful. So, yeah. And for some of our listeners who might be, let's say, interested in coming to your clinic, so how can they find you?
The website is Global Apheresis.com. And apheresis is spelled APHERESIS.
Okay. And you're located in Mill Valley, California?
Yeah, we are located in Mill Valley, California, and we have clinics in La Jolla, San Diego, LA.
Oh, well. You're definitely
Boca Raton, Florida, and we just started in Orlando, Florida.
Well, that's wonderful. So Can you tell me if the insurances cover this treatment, or this is mostly out-of-pocket expense?
The insurance doesn't cover the treatment at the moment. It is an out-of-pocket expense. We are doing these controlled clinical trials in order to convince the insurance companies that this is basically a preventive measure that can save them a lot of money.
Exactly.
Because if we can prevent many of these chronic inflammatory diseases that kill people, they'll be very helpful, obviously. But one thing that we hope to help, and I think we are showing this with this trial, is that we are increasing the health span of people. So today's medicine is very good and keeps people alive,
Right.
but so they may live longer, but they're not healthier. Most people that live longer are not healthy enough to enjoy life, to participate in sports, to walk, to live normal life. Many of them are on wheelchairs or in bed and all that. So we try to prevent this from happening, and this can save a lot of money to insurance companies, to all of us, because we pay the insurance of many people as well. So the hope is to convince the insurance companies within the next few years to adopt that as a treatment. There is a battle. I think it's mainly scientific battle, whether aging is a disease. A lot of people don't accept aging as a disease, but as a normal process, it's just nothing we can do about it. We obviously disagree with that, but we have to do controlled clinical trials and convince the scientific and medical community that this is not the case and there is room for intervention for aging.
Wow, that would be fantastic. Yeah, best of luck to you for this battle, as you said. So that would definitely serve our humanity really well. So
Right.
yeah. Well, thank you so much for coming and enlightening us on this very unique topic. So such a popular topic these days. So, and you're such a famous doctor in the field. So maybe one day we'll invite you back. So after your enigmatic new studies are published. So
Happy to come back.
Yeah, thank you. I really appreciate Dobri. Yeah, that was really interesting.
You're very welcome. I'm glad you liked it.
Yeah. And thank you for joining us at Cures, Remedies, and Beyond, exploring science and the wisdom of health and healing. We hope to see you next time.